Let's imagine a scenario when someone or a loved one suddenly collapses in front of you after a cardiac arrest and you cannot do anything. It's not a scene from a movie, but a scenario that is getting common. Even young adults are suffering from sudden cardiac arrest due to sedentary and stressful lifestyles. As per the World Health Organization census statistics, mortality due to cardiac causes has overtaken mortality due to all cancers put together. As per WHO, approximately 4,280 out of every 1 lakh people die every year from sudden cardiac arrest in India alone. Isn't this a shocking statistic? The good news is that most of these lives can be saved. It has been proven that bystander CPR improves the rate of survival by almost 50%. It is even more important if you have a loved one who has a history of cardiac disease, as research reports that a majority of cardiac arrests occur at home. CPR knowledge will equip you with the skill and the confidence needed to transform yourself from the role of bystander to a lifesaver. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. Dr. Anshul Jain, HOD Cardiology, MMH Medical College Saharanpur, Dr. Saurabh Nagar, HOD Cardiology, SSB Trauma Center, Firozabad, and Dr. Colonel Ajay Bahadur, HOD Cardiology, Apollo Medics Super Speciality Hospital, Lucknow. Let's get straight into our discussion. Cardiovascular disease is the #1 cause of death worldwide. What are the cardiac emergencies which can lead to death on the spot? Dr. Anshul Jain.
See, cardiac emergencies which can lead to death on spot are grouped under category of sudden cardiac arrest or sudden cardiac death. If we look at the age-wise causes, in children, most common cause is usually complex congenital heart diseases, which may present with recurrent respiratory infections, heart failures, or cyanotic episodes. And another causes are channelopathies like Brugada and long QTs, which may present with malignant arrhythmias and are usually the most common cause of sudden death in infants. Looking at the causes, in less than 35 years of age, young adults and adolescents, most common cause is hypertrophic cardiomyopathies, which are responsible for death among 50% of the cases and is the most common cause of sudden death in the athletes. And another causes are like abnormal coronaries or myocarditis and valvular heart disease followed by coronary diseases. Whereas in age group more than 35 years of age, predominant cases occur between 45 to 75 years of age, and the most common causes is coronary artery diseases, which contribute to 80% of the cases, followed by dilated hearts, valvular heart disease, severe aortic stenosis or myocarditis, to name a few. And if we look at the data in males and females, in males 80% of the coronary diseases occur as a cause of cardiac arrest, followed by dilated hearts and valvular heart diseases, whereas in females 50% of the cases contribute to sudden death because of the coronaries, followed by dilated hearts, which also includes cases occurring peripartum or post-delivery cardiomyopathies and valvular heart diseases. Then we have predisposing factors like males, those with smoking, diabetes mellitus, previous atrial fibrillation, obstructive sleep apnea, and chronic kidney diseases, and those with family history of sudden cardiac arrest are predisposed. And then there are trigger events like acute ischemic insult or heart failure or myocarditis, electrolyte imbalance, especially that of potassium, use of recreational drugs and anabolic steroids. So it is an interplay of underlying causes, predisposing factors, and trigger events which lead to sudden death in a patient.
All right. Now, is it true that sudden cardiac arrest can impact virtually anyone, including seemingly healthy people? If yes, why is that so? Dr. Saurav Nagar.
Yeah, it is very true. Practically a burning question right now. It is very true that the sudden cardiac arrest can impact anyone, even the seemingly healthy people. First, we should understand what is sudden cardiac arrest. Sudden cardiac arrest is when the heart unexpectedly stops pumping. It becomes a life-threatening emergency. Now, what are the causes behind it? It can be because of a coronary artery disease or a cardiomyopathy or as a complication of a heart failure. What is coronary artery disease? In these cases, there is clotting in the vessels supplying the heart. So all of a sudden, if a massive clot occurs that supplies blood to the heart, there is a sudden cessation of blood flow to the heart that might lead to a sudden cardiac arrest. The other factors can be a dystrophy or a disease of the muscles of the heart that we call as cardiomyopathy. That is very prevalent in young athletes, as already previously told by our fellow colleague, that hypertrophic obstructive cardiomyopathy is one of such causes, and other causes that lead to disease of the muscles of the heart may cause sudden cardiac arrest. Other things can be a complication of heart failure. All these factors, all these diseases, when clubbed together, can give rise to arrhythmias. Arrhythmias are the disarrayed beating of the heart that might cause decreased pumping capacity of the heart. So after a decrease in the pumping capacity of the heart is there is cessation of blood flow to the brain, which causes the patient to have a sudden collapse. That is manifested as a sudden cardiac arrest. So ultimately, what we have to do when there is cessation of blood flow to the brain, there is a sudden cardiac arrest because of faulty pumping of the heart. So that is where the importance of CPR lies. That since the heart is not able to pump the blood properly by its own self, we need to manually compress it so as to maintain the blood flow to the brain, and we can prevent a fatality by this means, because if we have got a limited time span for the cells of the brain to be alive, if we are able to maintain blood flow at that time till the time the CPR is going on, we are able to maintain that blood flow. We can actually save a life by that means.
All right, but we all know that if it's not treated, sudden cardiac arrest can cause death within minutes. What are the chances of surviving SCA, and in what cases do chances of surviving are more? Dr. Colonel Ajay Bahadur?
Thank you for the question, Mahi. As my esteemed colleagues have brought out earlier, sudden cardiac arrest is a worldwide killer. It's a word, it's a terminology which has come into vogue all the more due to various recent happenings of high-profile people having sudden deaths. So it can affect, as it was brought out, anyone, anytime, anywhere. It occurs when the heart's electrical circuit malfunctions due to some cause, and the heart for some time stops beating effectively, as a result of which the blood supply to the brain and all essential organs stops, and this can lead to death. Although pre-existing heart disease is a common cause of sudden cardiac arrest, SCA, as you said, many victims have never had a heart problem. No underlying heart problem, no disease. Say, for example, somebody who drowns, meets a road traffic accident, or gets electrocuted. Various situations like these, people can have cardiac arrest. So also now we have to remember a temporal profile. We have to understand that once the heart stops beating effectively, then within 10 to 15 minutes, the individual falls unconscious. Within 30 seconds, there is a respiratory arrest. The individual stops breathing. Within 3 to 5 minutes of the heart stopping, the brain starts getting damaged. And in the next 10 minutes or so, there's a permanent brain damage and the individual dies. There's a brain death. So we have to remember the time period, which is very important. A couple of figures. Every year, you brought out few lakhs in India. there are around 4 to 5 lakh cardiac arrests which happen in US out of hospital, sudden cardiac arrests. And can you imagine, almost 90% are fatal. That high a figure, that too in United States, which is considered one of the most advanced societies in the world. So our figures are even worse. 90% of people who sustain sudden cardiac arrest out of hospital may die. It may be fatal. So that's a very high percentage, and that's why it's very important that most of us get trained in basic life support and cardiopulmonary resuscitation, which will increase the incidence of survival. In fact, in the US only, there's a study where in a controlled environment where everybody was trained in CPR, the survival rate increased to 45%.
Okay.
That's the kind of jump which happened with people who were all trained in CPR.
So
Coming to your question, just one word about that. The chances of survival are better in younger individuals, those who do not have underlying heart disease, and most importantly, those who get CPR within 3 minutes of cardiac arrest.
Okay, so does CPR apply in both conditions like cardiac arrest and heart attack? Dr. Anshul Jain?
See, heart attack is the major contributor of cardiac arrest, as this is further stretched out by a 50% rule, which says that cardiac arrest is responsible for 50% of the all cardiovascular death. Secondly, cardiac arrest is the first expression of underlying cardiovascular disease in 50% of the cases. And thirdly, cardiac arrest is responsible for 50% of the years of lives lost due to underlying cardiac diseases. Looking at the epidemiology, as we have already seen that in males, 80% of the cases of cardiac arrest is because of the coronary events, and in women approximately 50% is because of the coronary event. Looking at the worldwide data, in Western countries approximately 70 to 80% of the cases of sudden cardiac arrest is because of the underlying coronary causes, whereas in Japan around 50 to 60% of the cases are because of cardiac arrest. It may start as a prodromal signs of chest pain or breathlessness or lightheadedness or fatigue, which may occur months to few hours before the impending crisis, then further progressing to acute ischemic insult and heart failure, loss of respiration, loss of blood pressure, further leading to decreased contractility, malignant arrhythmias, and loss of circulation, and ultimately collapse. Especially patients with dilated hearts and those with pumping power less than 35%, diabetics, and family history of sudden cardiac death are predisposed to such an event. And so lay standards or the bystanders should be educated about when to act, when to recognize the impending crisis and act swiftly. Thank you.
Which is then the first correct step when you are at a scene where a person has collapsed? Dr. Saurabh?
If someone has become unresponsive and are not breathing normally, they could be in cardiac arrest. So if we come across a person who has suddenly collapsed and doesn't respond to a hard tap on the shoulder or even on calling out loudly, check if the pulse, if the person isn't breathing, he might just be gasping for air. And if he is not breathing, carry the person to a flat surface and verify the safety of the surroundings as well. Call for help and ambulance. Now is the time that you should assess for breathing and for the carotid pulse. For breathing, you hold your index finger to the nostrils and check whether the person is breathing, exhaling properly, and then look for the carotid pulse by placing your hand on the neck of the patient, so-called. If there is no breath or pulse, that is the time that we should start the CPR and the chest compressions and the rescue breaths as well in the ratio of 30:2, sorry. That is 30 chest compressions should be there and followed by 2 rescue breaths. The bystanders should not panic at that time. He should be trained that it is a life-saving therapy for the patient. At that time, if he is able to give a proper chest compression, like the sternum should be depressed to about 5 centimeters. That will maintain the blood flow to the brain, and that might save the life of a person as well.
All right. On that note, we'll take a very quick break, but we'll be back with more on this discussion. Stay with us. Welcome back. Let me go across to Dr. Colonel Ajay Bahadur. So what is the ABC of CPR? Do we need to check the airway first and then perform CPR?
Thanks for the question, Maha. Yes, ABC actually stands for airway, breathing, circulation. And in a CPR, when you are doing a CPR, first check is the airway. However, let me put few things in perspective. I would go to the extent of saying ABCD, that is airway, breathing, circulation, defibrillation. I'll be touching upon defibrillation later. Also, these days, American Heart Association and the world over, the concept is rather than ABC of CPR, we are saying CAB of CPR. That is compressions first. So compressions are extremely important. Airway and breathing should be secondary. Compressions are most important because chest compressions are the ones which allow you to manually pump the blood through the heart to the rest of the body, which is what will keep the person alive. Blood circulation is extremely vital to keep all organs alive. In short, 7 steps of CPR, I would say, are checking the scene, very important for the person who's doing the CPR and individual, the victim. Should be safe, be it fire, drowning, wherever the situation has to be safe. Take no more than 10 seconds to assess whether it's a cardiac arrest. Call for help. Number 2, India, we have the number 108. Call that for assistance, medical assistance. Open the airway, check for breathing, whether the individual is breathing or not. Start chest compressions at 100 to 120 per minute. Deliver rescue breaths as brought out earlier, 30 to 30 chest compressions to 2 breaths, and repeat the whole cycle. So these are the 7 steps we should carry on. One last word about the chest compressions. The rate and the depth of compressions is very important. The chest should move around 2 to 2.5 inches, and the rate of chest compressions should be 100 to 120 per minute. In a lighter vein, very easy to remember the songs Another One Bites the Dust by Queen, or the Staying Alive song by the John Travolta song by Bee Gees, Staying Alive. So if you think of that beat, that's the way you have to compress the chest during a CPR.
All right. Are there different types of CPRs? Which is the most commonly used, Dr. Anshul?
See, CPR works on 2 principles. First is to maintain appropriate cardiopulmonary circulation, and second on achieving spontaneous circulation as early as possible. Depending on the settings in which it is being conducted, there are 2 types, like in hospital cardiac arrest and then out hospital or the community cardiac arrest. In hospital, after calling for the cord, we straight away proceed to advanced life support, whereas when in the community, it is first to call for help, then basic support, then defibrillation, and then advanced support. Knowing about the when to act, the key elements are unresponsiveness to voice and lack of respiration or poor respiration, paleness of the skin or bluish discoloration, and then we proceed with the chest compressions. As already highlighted, it should be done in 30:2, and the important thing is, even on the slightest suspicion of cardiac arrest, the lay person should act and start with the chest compression. And even the trials have shown that no harm is done if the situation is falsely judged to be cardiac arrest. And also the data shows that less than 40% of the community acquired cardiac arrest receive CPR by the bystanders. So bystander education is very important in this scenario. And also I would like to highlight that the lay person should not spend time on checking for the pulse, and rather, if there is poor respiratory efforts, chest compression should be started so as to pump blood to the vital organs and prevent neurogenic collapse and to the essential organs.
Okay. There's always a fear, though, that if a person giving CPR is not well trained, what is the liability of a rescuer when attempting resuscitation? Dr. Sora?
Thank you. See, the dictum is that CPR saves a life. If we have got this as the mindset, then we will not be afraid of helping out a person. We should always remember that CPR saves a life. We should remove the fear. Going to aid for someone in the life-threatening situation is perfectly natural, humane response, which evidence has shows improved survival as well. The risk is vanishingly small. The dictum should be that whenever the patient is in requirement of a CPR, assess properly that yes, he has collapsed suddenly with cessation of pulse, verify the surroundings, call for help, go for chest compressions at the rate already discussed, at the rate of 100 to 120 per minute with 30:2 compressions, 30 compressions followed by 2 rescue breaths, and wait for the help. This is the dictum. With this mindset, we should never be afraid to help anybody out.
Okay, but how does an automatic external defibrillator, AED, help a person who's in cardiac arrest, Dr. Ajay?
Yeah, so AED or an automatic external defibrillator is a very lightweight battery operated machine. It's a portable device that checks the heart rhythm during an ongoing cardiac arrest for an individual, and after checking it can send a shock to the heart to restore the cardiac rhythm to normal. So this device is used to treat safe people who are having a cardiac arrest, and it's now available in most of the places like airports, malls, big areas, public areas. In the West, it's much more. We are also having that awareness, and we are having the AEDs placed in various places, in public places. So this machine has 2 sticky pads or electrodes which are immediately attached to a suspected cardiac arrest. And these electrodes sense the current of the heart, and if there is no adequate current, or if there's a shockable rhythm, then the machine itself, the AED, announces, it's got a speaker in itself, and it announces that the shock has to be given. Then all you have to do is just press a button, which then the machine will deliver the shock, and this can be life-saving.
Thank you, doctors. And as we can clearly see, the role of CPR is important to revive and save a life. With that, we are taking a very quick break. Stay with us.